Um, it's fantastic. And I'm just going to make a point. I remember, I'm not even catching who the name was, but I remember a researcher talking about the history of when the first AIDS patient, she was an MD and a researcher in San Francisco, and she talked about when the first patients were coming through, and I think that she was a CDC fellow or something at that time, and she talked about how exciting a time that was. And I'm looking at the look on your face, and that's exactly what my reaction was. How can you talk about this as exciting? It was horrific. It was devastating. It was painful. It was frightening. It was just something that no one would put exciting to. But now here we are in an era where we know through the science that treatment also not only works to get to viral suppression so that people live longer and healthier, but that it is a preventative force. That we now have pre-exposure prophylaxis called PrEP or post-exposure prophylaxis, and that's all coming from the new science. And it actually is exciting. It makes the energy that can wane after decades of doing this work renewable. It brings us a different lens to how we are re-energizing ourselves. The hope that we thought was dashed for a while of, are we just going to be on, testing people and giving treatment for the rest of our lives? We have other options now. And I don't know if I would have understood the role that a nonprofit organization or a community could play in every level of research, from the asking the questions to designing the protocols or designing the trials or designing the studies themselves, all the way to being able to interpret and to talk about and to translate what the results tell us. I don't think I would have been able to appreciate that if I did not force ourselves as an organization to understand what that research had to look like and then what our role could be in it. And I would say that where there are successful partnerships between the basic scientists, the clinical researchers, the social and behavioral researchers, and those of us who do research at community level, that there's so much for us to learn and to share with each other, that it actually makes this so much more meaningful, and it gives me another perspective on what hope looks like. I'm also looking at how we use what we know now around PrEP, around PEP, around treatment as prevention, around some of the other biomedical prevention options that are in the pipeline, whether it's the vaginal ring, because we do need so many more independent options for prevention for women, and for young people who don't necessarily take up the condoms and take up all of the things that we have. And I've reached another challenge that I think we need to challenge our health providers with, and that is ending this epidemic isn't just about stopping HIV. It's about really giving value and respect to sexual health and sexual well-being. And I think that in our public health sphere, we have spent the last 35 years focusing in on this epidemic, not on trying to make sure that people have healthy sexual lives, but that they avoid a disease. And I know that people don't go to see their providers to avoid disease. We go because we want to be healthy and we want to know that, well, if we want to be pregnant, we can have healthy children. Or how can I get more orgasms? How can I remove these issues that I'm having so that my sex life is of high quality, that it's satisfying, that it doesn't diminish my humanity? Because that's how, when many people go, you're talking to me as if I am the virus. You're talking to me as if that's all you care about is what I'm doing to stop getting a disease or possibly transmitting a disease. What I really want to know is, how can I be sexually healthy and whole? Because that's a part of who I am. That's a part of my humanness. That's a part of everyone's humanness. And I think that providers have a huge responsibility to shift some of that thinking when you have that patient in the exam room, to really talk about the quality of their sex life, and then add in some of that stuff around how to make it better by preventing disease, by engaging in more comprehensive conversations with partners, by understanding sex histories and what testing and screening and linking to services and treatment and taking medicines means for all of that. And PrEP is a perfect example of that. When I hear people talk about how it removes so much of the anxiety that they have every time they engage in sex with someone, that is a bigger driver for me to think about taking a pill every day to prevent HIV than the fact that you want me to stop a disease.